Well, joining us now, Dr. Jan-Cédric Hansen, advisor to the West African Health Organization. Thank you for joining us here on France 24. How did she get Ebola?
Well, somewhere the protocol has a failure somewhere in the process. Most of the time it occurs when you disassemble your protection gowns. It would be interesting to know what was the protocol to remove all the protection for that nurse. If she does it on her own, she's most likely to have a contamination risk. If you have 2 people or 3 people to do that process and to protect the person who is inside, then you diminish the risk. And this is certainly the same reason why down in West Africa you have so many healthcare workers, because when you watch all the films that are made on how they remove their protections, I have seen many mistakes. So it is difficult to remove by yourself a protection with contaminated material on it without contaminating yourself.
But there is a procedure.
So there is a procedure. It would be very interesting to know what is precisely the procedure in this hospital. And if she was alone to do it, then she definitely exposed herself.
Last week, there was the first homegrown case in the United States, but it was a man who had traveled back from Liberia. This is different.
Yes, it is different. It's a secondary...
She never went to Africa.
No, but she was in contact with someone suffering from Ebola, so someone highly contaminating his environment.
So she treats the 2 priests. They die.
Yeah.
Priests who had missionaries who'd been to Africa.
Absolutely.
She goes home on September the 30th and gets admitted to hospital 5 days later. So why did it take so long for her to return to hospital? Because she did start to show symptoms.
Yeah.
And number 2, how many people might be infected?
How many people? That's a good question. One thing to remind and to keep in mind for everybody, as long as you have no fever, you are harmless to yourself and to your environment and the one you beloved. So if you are a healthcare professional working with Ebola, as long as you have no fever, there is no risk for others. Now, where it is quite surprising is that the hospital waited so long, like almost 5 days before they admitted she could have Ebola. It is certainly a case of overconfidence. We have procedures, the procedures are perfect, so it is not possible that she contracted Ebola. Syndinix tells you, no matter how good your procedures are, just think about the fact that there may be a leakage inside the procedure protection somewhere in the process, and definitely think about Ebola first. She shouldn't have left alone or walking in the streets for 5 days, because anything she touched and people she met and hugs and things like that are at higher risk of contamination. Her husband, for example.
Her husband, who is one of the people that is under observation at this point. This is a statement that came out from the World Health Organization. New Ebola fever cases in Europe are almost inevitable, but the continent is well prepared to face the disease. Not so sure that's the case when you see what's happened here in Madrid.
As I said previously here on France 24, it is inevitable that we have sporadic cases of Ebola in Europe because we have healthcare professionals working over there. Our procedures is to bring them back home if they get injured or ill. And we have travelers, working people over there, and when they come back, they may come back with the Ebola. So we may have sporadic cases. We are prepared to identify those cases and to contain the spread from those cases. So that's the way we are prepared, but we cannot avoid Ebola cases inside Europe. It will happen anywhere.
I want you to repeat something you just said a minute ago. You're saying that there is no way that you can spread the disease if you're not showing symptoms, right?
Absolutely. Absolutely.
So what did you think when you heard on French radio this morning the story about this primary school in the suburbs of Paris, a young boy who'd returned recently from Guinea, who's not showing symptoms, and some of the parents taking their kids out of the class and complaining about the school and complaining to authorities?
That's ignorance. They didn't know that you are not at risk of disseminating the disease as long as you don't show any symptoms. Fever is the first symptom, and you have to know that 38 degrees Celsius is the threshold from which you have to consider you have fever. And if you are coming from West Africa, or if you have been in contact with someone who you know has Ebola, then you should call emergency center and tell them that you have the fear of getting Ebola. But this young guy coming back from West Africa is harmless for his friends in the school, and he may stay in the school as long as he has no fever. So it's over protection, and it's irrelevant to behave like that. But parents are parents.
Should his temperature be checked every day?
Yes, of course. This should be done. If he has been in an area at risk, then we should monitor definitely his temperature. Twice a day is enough.
How much of a strain do you think, when you talk about taking people's temperature, if you take the temperature of everyone in France who's returned from West Africa, how much of a system is it on the healthcare system?
How much of restraint?
A strain on the healthcare system.
It will be, but you can do it at home. I mean, a regular thermometer will do it, so you can monitor yourself. But if you are back from Africa or back to a place where you know Ebola is evolving, then you should monitor twice a day your temperature for 20 days, 22 days. And if no fever occurs, then you are free from the disease.
Should we also be checking our temperature if we're coming back from Madrid now after this?
No, if you were not in Madrid streets while this nurse was walking there. So no, not yet. There's no evidence that we should do this. We should not fear right now. We should be prepared. And if we are exposed, or we have the feeling that we may have been exposed, check our temperature. And that's all we need to do.
All we need to do right now, a word when you see how easy it can be transmitted, a word about the healthcare workers who are out there right now in West Africa.
Yeah, we are actually starting to work with the West African health authorities to create new guidelines to protect the healthcare workers, because definitely, as I mentioned, I've seen some mistakes while removing all the protections, and we definitely should reorganize that moment. And the second point is the time they spend with inside the infected area. They should reduce that time, because the longer you stay, the more chances to get infected you get. So they should stay less time inside the contaminated area and revise the procedures of removing all the protection. That's two main points to do, but there's other things.
So go out there, but use more rotations.
More rotations.
And your thought on the international help? There was big announcements a week ago to 10 days ago from the United States, from France, from Britain. Reading in the New York Times this Tuesday, it's really Médecins Sans Frontières that are the most present and up front right now, and these others are running a bit late in coming in to help.
Yes, well, it's difficult to find people to go there. You need to train the healthcare workers, because it's an unusual way of working. You are undergoing a high stress, specifically the heat stress, because you're in a tropical area and you have to wear very sealed garments. So it is a way to you need to learn and to be trained in order to go there. Otherwise, it's criminal to send you there. You'll be contaminated anyway.
But you're confident that help is on the way? Yeah,
help is on the way, and there's many people who want to fund. You have the Bill Gates Foundation, for example, and others they really want to fund. The question is what to fund, what is the needed material, and what is the needed professionals to send over there.
The right people to send.
The right people to send.
Dr. Jan-Cédric Hansen, I want to thank you for joining us today on France 24. Dr. Jan-Cédric Hansen, advisor to the West African Health Organization, a subsidiary of ECOWAS. Thank you for being with us. And later on,